Hey guys, Nick Mahavich, Active Physical Therapy. Last week we went over if you have back pain and you think it's possibly a herniated disc or bulging disc. What we're going to do this week is we're going to go over back pain that may be caused from arthritis, stenosis, degeneration, all those degenerative forms that can cause a lot of pain. Cause pain in the back and cause pain down actually both legs if you have it. So when people have this, they usually have 50 or more birthday candles on their cake. Sounds kind of funny, but they're usually 50 years of age or older. They have difficulty standing for a long time. They have difficulty walking for a long time. If you go to sit down and it relieves your pain, this is probably for you. This is probably what's going on with your back. If it hurts you to extend or lean backwards, if you're trying to lean up into a high cabinet, this may be what's causing your pain. So we're going to give you 3 exercises this time. Top 3 exercises you can do to help arthritis, stenosis, any kind of degeneration in your low back. So the first one is real easy, and I like this one the best because you can do this anywhere you're at. You can do this when you're at the store, you can do this at home, at work, wherever. All you're going to do is sit in a chair or on a bench if you're out and about, and then all you're going to do is try to reach forward. You're going to reach forward and try to reach the floor. Now you may not reach the floor if it's tight, if it's restricted, if you're in a lot of pain, but what you're doing here is when you reach forward, you're opening up the joints in your back and where that stenosis and arthritis is at and relieving that pain. The next 2, you're going to be lying down. These can be done before you get out of bed in the morning. These can be done when the symptoms come on, if you're out in the yard, if you're out working, if you're out doing yard work, housework, any of that kind of stuff. Lay down, do these couple exercises. So the first one, real simple, and I like this one for almost every back exercise, back pain, is you're gonna lie down, and then you can see my knees coming towards the screen, and then away from the screen. So what we're gonna do is rock back and forth. Now, you're gonna rock back and forth maybe about 5-6 times. Again, what you're doing is you're opening up the joints in your back where that stenosis, degeneration, arthritis is. If you open up those joints, it makes you feel better. We're not getting rid of arthritis or stenosis, obviously, but if we get it moving better, you should feel better. The last one is a stretch that helps loosen up the muscles in the hip and the low back. And what you're going to do is, again, lie on your back. You're going to pull your one knee towards your opposite shoulder and then release. So you're going to do that about 10 times, back and forth. And then you're going to grab the other leg and do the same exact thing. We want to do both sides to make sure that we're getting everything loosened up. What I don't want you to do with that stretch or any of these stretches, I don't want you to hold it, especially if you have nerve pain. If you have pain going down your leg, numbness, tingling, pain, weakness, if you hold these stretches, it can actually irritate the nerve, because what you're doing is you're putting the nerve on a stretch, and the nerve does not like that at all. So don't hold it. I know we've been told in sports, in PE class, all of our lives, you need to hold stretches. Hold stretches are great to stretch out the muscles, but especially if you have nerve pain, back pain, it's going to irritate those nerves and back pain. So arthritis, stenosis, degeneration in the back, try these top 3 exercises, see if that helps you. I hope it does. If you have questions, if the pain is still bothering you and it's not going away, message me here on Facebook and I'll answer those questions, or give us a call at 402-932-2888, and you can talk to one of our physical therapists that specialize in back pain. All right, we'll see you guys next week. Have a good one.